Hi, my name is Rachel Saville and welcome to MEMcast's first PACES revision video. This session is aimed at candidates who are starting to prepare for their PACES exam, and so to familiarise you with the exam format and the mark scheme so you can better understand what lies ahead in your summative assessment. There are 5 stations within the PACES exam, and the respiratory exam sits within station 1, along with an abdominal exam. The format's due to change, so that respiratory exam will be paired with a communication station, but as of March 2022, this hasn't come into action yet. There are 2 clinical examination stations, a history-taking station and one focused on communication and ethical issues, and one in which you will perform 2 brief clinical consults. Prior to starting the carousel, a register will be taken and you'll need to write your name, examination number and centre number on the top of all of your mark sheets, which you'll carry on a clipboard around the carousel, handing the mark sheets over to the examiner at the appropriate station. You can either wear scrubs or smart, modest clothes for your exam. Your fingernails should be short and clean, and it's important you look professional, but you're also comfortable. You'll be bare below the elbows as you would in clinical practice, and if you do choose to wear a tie, it must be tucked in when examining patients so it doesn't fall onto them. For anyone with long hair, you should tie it back for the same reasons. And bring your stethoscope with you, but you'll not need any other equipment like a tendon hammer or ophthalmoscope. These will be provided if required. Each station is 20 minutes long, and with the COVID-friendly exam format, there are 2 mini carousels. The history-taking station and the communication ethics station, so 2 and 4, will form a mini circuit where you'll be shown into a room with a laptop and you'll consult the patient actor via video conference. The examiners will also be on the call but muted and ask you questions at the end. There's also a practical mini circuit for the stations that require hands-on examination skills, so that's 1, 3 and 5. Within the clinical examination station 1, you will be expected to perform the respiratory and the abdominal exams with discussion, so that's 10 minutes for each. Your clinical exam should take no longer than 6 minutes, leaving 4 minutes to present your findings and discuss with the examiner. There's an advisory warning when there's 1 minute left, and a 5-minute gap between each station, and currently extra time for donning and doffing PPE. For the history-taking station and the brief clinical consults, you'll be given a vignette outside of the room with some details of the case you're about to see. You can use this 5-minute gap to think of differentials or important questions to ask, management options, and you can make notes which can be taken into the room with you. Try to focus on the upcoming station alone and not what's just happened, good or bad, in the previous station. Take time to calm yourself and focus on the next 20-minute block. So in this next section, we're going to be focusing on station 1. You'll wait outside the room or cubicle before entering, where you can don your PPE. You'll be expected to wear a mask, apron and gloves, and there's an additional 1 minute to be able to put this on. A buzzer or bell will sound and you'll enter the examination room, which is when the 10-minute timer starts. You will hand your mark sheet to the examiner, there'll be 2 in the room in PPE, and read the instructions. For example, this lady's complaining of breathlessness, please examine their respiratory system. Introduce yourself to the patient and ensure they're comfortable, gaining consent to examine them. This is one way to maintain patient welfare. Here's the current mark scheme for the PACES exam station 1. As you can see, you're marked across 5 domains: physical examination skills, ability to correctly identify physical signs, construction of a differential diagnosis, your clinical judgment, and maintaining patient welfare. Each examiner will score you 0, 1 or 2 points for each domain. 0 means unsatisfactory, you missed important signs. 2 is satisfactory, and 1 is borderline. The points scored will be added together and go towards your final grade. There are 2 examiners in each station who will mark you independently for the 8 clinical encounters you'll have across the carousel. To pass PACES, you'll be required to attain a minimum standard in each of the 7 skills assessed, and also attain a minimal total score across the whole assessment. Looking back to 2017, the pass marks were as shown. Any candidate scoring 28 or less in maintaining patient welfare has their overall performance reviewed by the exam board and could fail the exam regardless of their total test score. After the clinical examination is complete, you'll turn to your examiner and present your clinical findings. Then you'll have a clinical discussion with one of the examiners who will take the lead for that station. In this discussion, you will likely discuss your clinical findings on examination, differential diagnosis, clinical management, including investigations and treatment options, When presenting, it's good to maintain eye contact with the examiners and try not to fidget. One way of helping this is to keep your hands clasped in front or behind you. Say both the relevant, positive and negatives in a sensible order, and think about whether you can comment on disease severity or activity, and if there's any evidence of complications. At the end of the examination, the bell or buzzer will ring. Thank the patient and your examiners and take off your PPE. Your mark sheet will stay with your examiners, and you'll take the clipboard with your other mark sheets attached to the next station and wait outside to begin again. You may undertake the respiratory or abdominal exam in either order within station 1. Hopefully, this short video has helped you familiarise yourself with the current exam format and marking criteria. I found that pairing up with someone who's also sitting the exam is particularly helpful, as you can practice both your examination and presenting skills and get regular feedback. MEMcast have some other MRCP related material. There's MCQs and Facts of the Week over on our Instagram page at mem.cast, and we have weekly podcast episodes available on all streaming platforms. We have some more PACES related videos coming out in the near future, firstly focusing on the respiratory exam and looking at how to present and discuss your findings, so watch this space. So from everyone here at MEMcast, good luck in your upcoming exams, and we'll see you again soon.